In this section, we will talk about the blood coagulation tests in detail. Blood coagulation tests includes bleeding time, clotting time, prothrombin time, and international normalized ratio, moving towards bleeding time, when a sharp-pointed knife is used to pierce the tip of the finger or earlobe. Bleeding ordinarily lasts for 1 to 6 minutes. This time depends largely on the depth of the wound and degree of hyperemia in the finger or earlobe at the time of the test. Lack of any one of several of the clotting factors can prolong the bleeding time, but it is especially prolonged by lack of platelets. Now, let's discuss the other blood coagulation test, and that is clotting time. Many methods have been devised for determining blood clotting time. The one most widely used is to collect blood in a chemically clean glass test tube, and then to tip the tube back and forth about every 30 seconds until the blood has clotted. By this method, the normal clotting time is 6 to 10 minutes. Procedures using multiple test tubes have also been devised for determining clotting time more accurately. Unfortunately, the clotting time varies widely, depending on the method used for measuring it, so is no longer used in many clinics. Instead, measurements of the clotting factors themselves are made, using sophisticated chemical procedures. Now, let's discuss the prothrombin time and international normalized ratio. The prothrombin time indicates the concentration of prothrombin in the blood. It shows the relationship of prothrombin concentration to prothrombin time. The method for determining prothrombin time is that blood removed from the patient is immediately oxalated so that none of the prothrombin can change into thrombin. Then, a large excess of calcium ion and tissue factor is quickly mixed with the oxalated blood. The excess calcium nullifies the effect of the oxalate, and the tissue factor activates the prothrombin to thrombin reaction by means of the extrinsic clotting pathway. The time required for coagulation to take place is known as the prothrombin time. The shortness of the time is determined mainly by the prothrombin concentration. The normal prothrombin time is about 12 seconds. In each laboratory, a curve relating prothrombin concentration to prothrombin time is drawn for the method used, so that the prothrombin in the blood can be quantified. The result obtained for prothrombin time may vary considerably, even in the same individual, if there are differences in activity of the tissue factor and the analytical system used to perform the test. Tissue factor is isolated from human tissues, such as placental tissue, and different batches may have different activity. Moving towards the international normalized ratio. The international normalized ratio was devised as a way to standardize measurements of prothrombin time. For each batch of tissue factor, the manufacturer assigns an international sensitivity index, which indicates the activity of the tissue factor with a standardized sample. The international sensitivity index usually varies between 1.0 and 2.0. The international normalized ratio is the ratio of the person's prothrombin time to a normal control sample raised to the power of the international sensitivity index. The normal range for international normalized ratio in a healthy person is 0.9 to 1.3. High international normalized ratio level, for example, 4 or 5, indicates a high risk of bleeding whereas a low international normalized ratio, for example, 0.5, suggests that there is a chance of having a clot. Patients with international normalized ratio 2.0 to 3.0 undergoing warfarin therapy. Tests similar to that for prothrombin time and international normalized ratio have been devised to determine the quantities of other blood clotting factors. In each of these tests, excesses of calcium, ions, and all the other factors, in addition to the one being tested, are added to oxalated blood all at once. Then the time required for coagulation is determined in the same manner as for prothrombin time. If the factor being tested is deficient, the coagulation time is prolonged. The time itself can then be used to quantitate the concentration of the factor. This was all about today's video. Stay tuned to sqadia.com for more precise and knowledge-stuffed videos.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.